Good afternoon, everybody. My name is Kent Mitchell. I'm the Director of State Affairs for the National Head Start Association, and I'm excited to welcome you today to this first in a three-part state policy webinar series from a number of great partners, NHSA, the National Community Action Partnership, Think Babies, and 0 to 3. We are so thrilled to be presenting this series to you starting today and running through late September. Again, a three-part series to focus on Head Start and early Head Start in the states, including the need for it in responding to COVID-19 and other rising needs in states. That's what we'll focus on today. In our successive ones later in next month and the month after that, we will talk about state policy solutions and advocacy and how to advance this cause for Head Start and early Head Start for at-risk kids and families in states. So with that, let's go ahead and get started with our webinar today. Again, thank you for joining. So excited to see 300 of you on this call today and over 800 who are registered. We have three learning goals for today. Our first is really to understand how Head Start has responded to COVID-19 and these times. We're going to hear from an amazing program director who's been in the field for many years, and their program has responded so well to the rising need in their community. We're also going to hear from a new state agency in New Mexico who has an amazing charge to support and care for children and families, particularly at-risk children and families in New Mexico. And we're going to hear how they have responded to COVID-19, some of the incredible and innovative things they've done, and how they are thinking about that mixed delivery system, including Head Start in their state. And then finally, we're going to hear from 0 to 3 about their State of Babies report from 2020, which really showcases and illuminates the access gaps for our infants and our toddlers by geography, race, by policy, and by other factors. So we're thrilled to have 0 to 3 on the call as well. But before we begin, I wanted to go through a little bit of background about NHSA and a little bit more about the partnership that's on display here through this webinar. So first, if you don't know NHSA, we really view ourselves as the Head Start community. Our mission is to coalesce, inspire, and support the Head Start field as a leader in early childhood development and education. We are proud to be the voice for 1 million children, 1,600 programs, 270,000 staff. It's an amazing community, and you can see a lot of them gathered there in that picture on Capitol Hill at one of our advocacy days. We also partner with 50 state Head Start associations. That's my day job, is to partner with those associations, and the 50 state collaboration directors who are generally in state government and working across systems and making sure Head Start has a seat at the table and is a good partner to childcare, pre-K, and other systems. So that's a little bit about NHSA and our Head Start community. And I would say this moment in time obviously is challenging for systems and for people and for our families and our children, but we rely a lot on our history as Head Start, which is really a bedrock in these challenging times. Obviously, Head Start was started in 1965 as a result of the civil rights movement. And you can't divorce that history. That history is so core toward our mission to serve and support the most at-risk children and families, including Black families and children in America. Head Start, again, created in '65 and is now really relying on that a history of our values, our engagement, our principles, and our strength in our community as we fight and work to support families and communities through this COVID-19 health crisis, this pandemic, which is also an economic crisis, which impacts so many communities and families. And of course, as we take more steps as institutions and leaders to address structural racism and say very clearly that every Black life matters, that the life of every Black child matters, and that is our position at NHSA. I know that's your position on the call and the position of our partners, and we are thrilled to be part of that movement and taking steps as an institution and a field to do better in our field and by all people in our country. So Head Start has responded with clarity Again, I think we've been really fortunate to rely on our history of accountability, of innovation, of service, of the principles, including parent engagement and parent involvement, has really carried our community through this time. And the reality is, while most Head Start programs, of course, had to take a pause when we went on the national lockdown, they never stopped serving families. They quickly returned, serving families in new ways. Many programs served essential workers. We're going to hear from one of those programs today from Salem, Oregon, but all programs have continued to be a lifeline to families during this crisis, doing really exemplary work, in particular around food service, meal delivery, nutrition, expanding access to technology and the internet, which is so critical for virtual learning and virtual early childhood education opportunities, and some of the simple things, right? Like reminding families that Head Start's there, parading through neighborhoods to make children smile or wish them a happy birthday, or to do virtual kindergarten graduation, rising kindergartner ceremonies. And I should mention also, not on here, a lot of programs are providing summer services, helping to close that achievement gap in the summer, which has been widened by COVID-19 and the lack of in-person access. So our community has never stopped serving, and of course we have more to do, but really proud of Head Start and what it has done during this time. Partnerships for child health and access are obviously really critical. We know the health issues that this crisis has created, but even before that time, we were really honored to be a grantee of Voices for Healthy Kids. It is an initiative of the American Heart Association that works around the country to improve or create equitable places that will make the places kids live, learn, and play healthier. And they have been partnering with us, with 0 to 3, with the National Community Action Partnership, and about 20 other organizations to host a national coalition to advance Head Start and early Head Start, both federally but at the state level as well. We've been really digging into state data, supporting states in different ways, developing policy solutions and issue briefs, and of course this 3-part series. So I want to hold up and honor and thank the American Heart Association and Voices for Healthy Kids for their support. There's so many good reasons to support Head Start, but of course for that partnership with Voices, looking right there in the middle, we know improved health is one of the benefits of Head Start and early Head Start. Stronger families and economic self-sufficiency. This graphic always melts my heart, because I think this is what we're all about. This is about the impact we have on families and on children, and that is what we are all about, and always about Head Start getting results for kids, families, and for communities. So with that, that's a bit of the preamble there, but I want to dig right into our panel, because they're really going to illuminate for you how Head Start has responded and how Head Start is going to adapt and rise to the challenges in states, and how you can do that, and how you can do that with us. So first, I want to introduce Ava Pignati, who is the Head Start and Early Head Start Director for Mid-Willamette Valley Community Action Head Start of Marion and Polk counties in Salem, Oregon. She's a native Oregonian, and she lives in Salem with her husband and 2 little dogs. A veteran in the program since 1999, Ava took on the role of program director in October 2015. She oversees services to 1,001 children and 240 staff, and she holds a bachelor's degree in business with a focus on the public sector. Giovanna Archuleta comes from the Pueblo of Nambe and was recently appointed as the Assistant Secretary for Native American Early Education and Care with the New Mexico Early Childhood Education and Care Department, an exciting new agency in New Mexico, which just had its launch recently. Through her previous position as the Pueblo Outreach Coordinator with the LANL Foundation, she began to learn about the importance of early childhood development and helped 8 northern Pueblos create individual early childhood plans to strengthen family support services, a project that was funded by the Kellogg Foundation. As a mother of 2, she continues to promote positive early learning experiences throughout the state of New Mexico and listens to the guidance from tribal communities. Finally, Kim Keating is a senior policy research analyst in the 0 to 3 Policy Center. Since joining 0 to 3 in 2018, she has had primary responsibility for the development of the annual State of Babies Yearbook, which is produced as part of 0 to 3's Think Babies with data and analysis powered by child trends. Prior to joining 0 to 3, she worked at James Bell Associates for 13 years, where she conducted national evaluations of child welfare programs and provided evaluation training and technical assistance. Prior to that, and important for this call, she served for 10 years as project manager of the annual Program Information Report, or PIR, data collection effort for the Office of Head Start, and led numerous other research and data projects. Ms. Keating holds a master's degree in counseling and human development with a specialization in infant and toddler mental health from George Mason University and a bachelor's degree in psychology from the University of Virginia. We're honored to have this amazing panel today, and I'm going to go ahead and turn it over to Ava to begin her discussion of their response in Salem, Oregon. Ava.
Thank you, Kent. It's a pleasure to be here. I was pretty nervous when I heard there were 800 people registered, but I decided since it's virtual, I can pretend you're all home in your underwear, and that might even be true. So I'm program director for Community Action Head Start of Marion and Polk counties. We operate a Head Start program, an Early Head Start, and an Early Head Start Child Care Partnerships program. So we have a little bit of every kind of program option. You can go to the next slide. I really want to talk with you about our experiences that will help you if you're reopening for the first time since COVID. We started out doing remote services for a short period of time after we were closed down by the virus. And then we went into emergency child care, and then from that straight into providing summer services. So one of the important pieces of this is to make sure you are working with your funders, your health authorities, and your licensing officials for your area. Every state and every governor is making plans and decisions. They might not all be the same. In our experience, the funders have allowed us to make our own plans and decisions and just want to be kept informed. The health authorities inform the governor who makes the decisions about opening child care or closing child care. And Head Start in Oregon, at least, is treated as a child care center for these conversations. So our state licensing officials then tell us when and how we can operate, and that could include a lot of different restrictions like caps on group sizes, enhanced sanitation, doing daily health checks on staff and children, and exclusion rules. And then also be sure you're familiar with the changes that USDA CACFP has made. Flexibilities during the COVID time will be very valuable information. Next slide, please. Next slide, Kent.
You should be on emergency child care. Can you see that now?
No, I'm seeing child care reopening still.
Okay.
There we go.
There we go.
We were asked by our state funders to try to find a way to do emergency child care for first responders. This was early on during the March period of time when the closure had just happened, and they were finding that we had a lot of folks who needed to go to work who, I think you're one slide ahead of me now, Kent.
Okay.
We had healthcare workers from the hospital, law enforcement, medical staff, and some essential workers who did things like process unemployment claims, who really needed care. And so we jumped in there and we got an emergency child care license so that we could start serving children. And we served them for the month of April and May. 36 kids at one of our centers. And then we also loaned 7 staff to a partner who is serving emergency child care as well. So for 2 months, we provided support to child care for first responders. It was free to them. It was full-time care Monday through Friday, 7:30 to 5:30. And the staff who did the work volunteered to do the work and were paid hazard pay, 25% hazard pay. So having that opportunity to dip our feet in the water early with emergency child care helped us a ton when it came time to plan for our summer services. Next slide, please, Kent. So in the summer, we wanted to bring back our children who should have been attending year-round. All of our duration model kids, our full day, full year kids, and our early Head Start kids are supposed to attend 12 months. I don't have the right slide yet. Still, I'm on emergency child care, but there we go. So when we went to open, we also did the grant for supplemental summer programming through HHS to have all of our rising kinders from our regular part-year program come back for an 8-week summer program, which we're about 2/3 of the way through right now. Getting all those classrooms set up and the staff back, we learned a lot of lessons, and this is real nuts and bolts stuff here. Things are hard to come by right now, and especially things related to health and safety. So make sure that you're looking ahead at what you need and where to get it and how long it'll take. We had so many items on back order or that didn't come at all, and we really had to scramble to find things like the plastic face shields for bus drivers, the face masks that we provided to staff on request, alcohol-based sanitizer wipes, hand sanitizer and gloves, and scrubs. And if you would go to the next slide. The biggest thing was, I'm echoing back at myself. I don't know what changed.
We can hear you fine if you're able to.
Okay. I'll try to ignore it. The hardest thing for us was to find the no-touch thermometers that you really need to do daily health checks. So we're mandated to do daily health checks for all children and staff before they enter a classroom or a school bus. And these thermometers were like gold to try and find them, and they're expensive and difficult to locate. You're going to want one for every classroom and every bus. And the regular oral or ear thermometers just take too long for this, especially if you think about stopping your bus with a red light stop and 3 or 4 kids waiting to get on the bus. It's essential that you have these no-touch thermometers in hand before you start doing your services. Next slide, please. So this is just photos of our staff doing some daily health checks with some kids. Tried to put some real life stuff in here just to make it come alive for you. Next slide, please. Next slide, please. There we go. We have to social distance school during times of COVID. So we're running classes capped at 10 children where we would normally have 20. And we're staking out seats for them that are distanced for circle time, different independent play areas so that children can learn about social distance and try to stay safe. Next slide, please. So it's been a journey. Food service changed dramatically. We have always done family style dining. I'm sure many of you do. That's not allowed right now. We have to do what they call restaurant style dining. So preparing individual plates in the kitchen for each child, wrapping them up and delivering them to the classroom. So it's been a journey, but you know what? It worked out. It's going to be okay. Just being flexible is the key to getting through all these changes. Next slide, please. This is pictures of our staff sanitizing things we never thought we'd ever have to sanitize. Play structures are with bleach solution after each group of children. You can see one person is using like you would use to spray weed killer in your yard, but it's got bleach solution, and the woman on the right is using spray bottles. In between is a bus driver, and she is sanitizing seat belts, clips, buckles, handrails, and of course seats on the bus between each group of kids. Next slide, please. Remote learning is a very real and tangible thing that can help you return to service. When we decided to reopen, we didn't really know what parents were going to feel safe doing. And we had about 40% choose to return to the classroom, and the other 60% said, no, we're not ready to do that yet. So we continued with our remote learning plan that we had been doing since the closure. And then we had a lot of families jump between. They started in the classroom and then they got nervous and said, no, we don't want to do that. Or they started in remote learning and then they saw that the classroom was working out for a friend, so they asked to move into the classroom. So it's a very fluid dynamic. When we're doing our remote learning, we've had the lesson plan for the classroom applied to the kids at home doing the remote learning as well. So it makes it a little smoother for the teacher to prepare materials for activities, some to be done in the classroom, some delivered to the homes of the parents. In the fall, when we reopen for the next school year, we're going to have dedicated remote learning teams. So the classroom teachers will just do the classroom kids, and the remote learning teams will just do the remote kids. There'll be teachers and teacher assistants doing that, supported by bus drivers and family service workers, because we tend to have a lot of things we need to take out and do no contact delivery to the families. In addition to their activities for learning, we also bring them food and diapers that we typically would provide to their child in the classroom. We're taking it to the families at home. And we also have a supply of tablets and Wi-Fi hotspot devices that we purchased with our CARES funding to allow parents who don't have the ability to access the remote services to be able to log in. Next slide, please. If you can do it, staff incentives and considerations are really critical. Our staff, after being at home working remotely for a period of time, were all over the map as far as their willingness to come back to work, their fear factor. Some people have high risk health status. Some people had children at home with schools closed and no child care. So being able to really engage with the staff and support them and find the best option for them is really critical. The folks who can't come in or are afraid to come in, there's your remote service team. The staff who were able to come in, we paid hazard pay to them, 25% extra for any hours in direct contact with clients. That exhausted our CARES funding, so we won't have any funding to continue that unless it comes through in the next wave of COVID support from the government. And also be really ready. We thought it was going to be kids that were going to be coming to school and having positive tests or symptoms. It's been the staff, not the kids. So staff come in sick, get sent home, staff get exposed out in the community, and then come to work. We have to do kind of our own version of contact tracing to very quickly identify anybody that was exposed and put them into self-quarantine mode. And you need a lot of substitutes to keep going. We've had to shut down classes due to shortage of staff. And you can't have folks jumping from every hither and yon in every classroom, because you're supposed to try and keep your small, stable groups kind of apart. And so having a sub assigned to a specific set of classes is a really good idea. And next slide.
Okay. I think that is the end of your presentation, Ava.
Oh, great. I wasn't sure if I had one more or not.
Yeah, thank you.
I just want to encourage you to you can reach out to me via email or anything else if you'd like to. If you have specific questions when you get ready to reopen, I'm happy to work with programs and share anything we've learned.
Thank you so much. And a few things struck me as I was listening to you, and thank you again. One is that, you know, a lot of HEAD programs like yours and Head Start never stop serving. And so you have a lot of lessons to share. And so we're so appreciative of your opportunity and ability to do that here today. The other thing, of course, is just the need to be so fluid. I guess what I hear from you is how quickly things can change. Also, especially around staffing, which of course is the lifeblood of early childhood, the relationships and the staffing. And so that's such a critical component. And then as I'll share with our audience, we're going to get to calls to action at the end of this call, but boy, do we need more financial support for childcare, for Head Start, for our early childhood programs and communities. So things like hazard pay, PPE, mental health supports, all those things can take place as we continue to struggle with the pandemic as a country. And so thank you for bringing to life those issues. We really appreciate that. Sorry, go ahead.
No, I just said it was my pleasure.
Thank you so much. I'm going to turn now to Giovanna Archuleta, and Giovanna, I'll turn it over to you, and I'm happy to advance your slides for you, so just let me know when.
Thank you, everyone. New Mexico is in monsoon season, and there is a big gray cloud headed my way, so I hope I don't lose you all. So thank you, everyone, for being here. I'm Giovanna Archuleta, and don't let that picture fool you. That was a pre-toddler picture that I took, so I've aged. I'm Giovanna. I am the new Assistant Secretary for Native American Early Education and Care with the new Early Childhood Education and Care Department. I was born and raised, like Kent said, in the Pueblo of Phnom Penh, raised my children here. I am new to state government. I started mid-February, and so I've had to have a lot of fast and furious learning since February. In March, we were sent home to really navigate this health emergency that our governor declared. I wanted to do a quick overview of our new first early childhood department. We are one of 4 in the country, and Kent, if you can advance to the next slide. We officially became a state agency on July 1st, but we've had to do a lot of work in making the transition while working through this health emergency. So in 2019, our Governor Michelle Lujan Grisham signed into law this new department. And now we oversee the programs of pre-K, early pre-K, childcare, home visiting, our family infant toddler program, which oversees early intervention, our Head Start State Collaboration Office, which Olga Valenzuela Zevea is on this call too, and she is the she's the Head Start Collaboration Director. The food and nutrition programs, and then a Families First home visiting case management program that got to come to our department. So we took out programs from CYFD, Children, Youth and Families Department, from the Public Education Department, and from the Department of Health to form this department. We went from 6 employees to now about 270. Some of our key responsibilities is to provide that seamless transition for children as they enter into pre-K and kindergarten, provide consumer education, advance quality early childhood education, so programs to support the development of children to prepare them for success in school, ensure effective collaboration, and I can't express that enough, collaboration, consultation, communication. Develop and manage effective data systems to guide our work so we could be effective. Develop an aligned system of workforce development, which we are in the process of doing, and it's some work that was able to follow me from the Lana Foundation. And I think most importantly, and from our tribal perspective, making sure that culture and language are at the center of most of our decision making, of our curriculum, of any type of early childhood support services. And in my position, it's a key role in collaboration and consultation with our respective tribes and nations of New Mexico. I'm going through this rather quickly so I don't lose you in case it does pour on us. Next slide, Kent. We have some guiding voices for Ec Ecd. So we do have an advisory council that was an application process. We've got about 300 applications, and we narrowed it down to between 30 and 35 folks from around the state to come up with a strategic plan. We have a transition committee, which consists of national experts and other cabinet secretaries, and they are guiding secretary in an actionable plan. Tribal liaisons have been identified within our divisions, and these folks will help me and our department look at the early childhood landscape within our tribal communities and just see what are the strengths and challenges as we try to promote services. And lastly, we have a reestablished children's cabinet, and these are just stakeholders from our sister agencies within the state. Next slide, please. So our COVID-19 safe practices have been ever changing, as Eva has said. We did quickly stand up a delivery system to get masks and gloves and thermometers to childcare centers that remains open. She was able to establish county leads because we are such a big state. So we had to look at where we could send big packages of PPE, and within those county leads, they were able to distribute around their areas. And we were also able to work with some distilleries and breweries who were making hand sanitizer, because we all knew that that was a hot commodity when this all happened. Our next was a CSP subcommittee for early childhood. Our governor established an economic recovery council, and so a part of that was a subcommittee that was put together to develop guidance on healthy and safe practices as we reopened or as we needed guidance throughout our state. And this was made up of key stakeholders and tribal communities to look at these practices. Partnerships were key. We developed and established partnerships with the key local nonprofits, Early Child Funders Group, our sister agencies, the New Mexico Economic Development Department, Department of Health, and they were essential to quickly getting needs met throughout our community. Sorry. And like Eva mentioned, you know, we had a bunch of lessons learned. Supplies were very rare and limited, so it took some time to get some of these items out to communities. Our meal services, we split up duties to ensure communities had food or access to meal sites. So I was literally calling quite a few of our tribal communities just to make sure they were set up and that they had food available for when the shutdown was going to happen. Some of our tribes opted for meal boxes through the USDA, so it was a Meals to You program. And that's because many of our tribes shut down their borders throughout the state. Testing. So our Family First program is registered nurses who were on the front line helping to provide COVID-19 testing. And like many of you, testing became mandatory for childcare and educator staff. Tribal supplies. With the tribal lands closed, we quickly established and were able to purchase 1,400 infant boxes that went out with supplies throughout the community, and they consisted of diapers and wipes and onesies, bassinets, formula, baby food and snacks, and a baby book. So we wanted to make sure that our infant population was not being left out of food supplies. Many of you may have experienced the decrease in immunizations, and so through home visiting and early intervention and our Department of Health campaign, we wanted to make sure that our families stayed up to date with their immunizations. Early intervention services did not stop. They just moved to telehealth, and families enjoyed still having access to these critical services. And communication was constant. In the next slide, you can kind of see how we set up childcare as we established daily provider calls. We have since moved to every other week, and this provided our communication to the childcare community. We provided subsidies based on enrollment, so not attendance, and I believe it was $200 for every student that was enrolled and qualified for childcare assistance. We prioritized essential workers, so they had access to childcare. We had a wage incentive program for staff that stayed working during the health emergency. We were able to establish a child care stabilization and recovery grant, and New Mexico did receive $29.4 million from the CARES Act for child care support. In the next slide, I believe that's it, and I just wanted to quickly go over what our state has in mind as we continue to learn and grow in these first 3 years. I always say, you know, the first 3 years of a child's life are very important, and so it will be for this new department. We just want to make sure that our continued collaboration is strong through our Head Start Collaboration Office. We want to make sure we strengthen our prenatal to 5 mixed delivery systems and look at what's working and highlight programs that have converted to include early Head Start, and pre-K. Of course, government to government, strong relationships with our tribal communities and state and local partnerships. And having the ability to provide choices for families, because we know each community is different. They all have cultural backgrounds that are different and needs that are different. And like our secretary always says, we just want a really cohesive, aligned, and high quality prenatal to 5 system. Olga and I and 2 other of our Ec Ecd colleagues are going to now work on establishing equity councils to meet the needs of our families. And we just want to make sure that this is a community and family driven service. And that's all I've got for you today, and it didn't rain yet. So I'm open for questions.
Thank you so much, Giovanna. I really hear a spirit of innovation and you all coming together as a state to build a better system and to do it so quickly during this pandemic. Appreciate you really holding up the cultural and linguistic diversity, which has always been something that Head Start has prized and valued. The work with tribes and tribal nations as well. I think I also go back to Eva's slide about, you know, sanitizing things that never had to be sanitized, and then thinking about the power of state government, right, to secure hand sanitizer from brewers, right, in your state. Things you never thought you'd probably have to do as a state agency when you join. But also want to lift up the fact that you're holding up these programs that are layering funding, early Head Start, pre-K, all in service of building a better P2-5 system. So congratulations again on the launch of your new agency, and thank you for your perspectives today. And we're going to turn it over to Kim Keating to walk through some of the key findings and insights from the State of Baby's Yearbook report. So Kim, I'll turn it over to you.
Great, thank you so much, Kent. And I just want to say I'm so happy to be part of this panel and to be with all of you today to talk about early Head Start. As Kent had mentioned at the beginning, I'm a senior policy research analyst in 0 to 3's Policy Center, and working in the policy area is something new to me. I'm more of a researcher, as you could tell from my description. But I think, like all of you on the call today, early Head Start and Head Start itself, for the bigger little ones, it's, as you can hear from everything that Eva and Giovanna have described, is more than a program, just a program. It's about community, as Kent mentioned, and for those who are involved in any way, it becomes a lifelong passion. So really pleased to be here. Next slide. So I wanted to tell you a little bit about the State of Baby's Yearbook. For those of you who may not have seen it before or who are familiar with it, it's an initiative that we began in 2019, so we're now in our 2nd year. And the yearbook is really a first of its kind resource for this age group, for infants and toddlers. It takes a holistic look at the nation's infants, toddlers, and their families. And we do that at both national and state levels. So it's kind of similar to Kids Count for the older age groups of children. Our goal at 0 to 3 in developing the State of Baby's Yearbook was to give policymakers and advocates and all the various stakeholders who are interested in the well-being of infants and toddlers a tool that they could use to do a number of things. And those very briefly are to tell the story of infants and toddlers within their states in particular, and then to be able to compare their own state's progress for infants and toddlers by using a common set of indicators that we developed. In the objectives, we also wanted you to be able to identify indicators on which babies and toddlers are not doing so well, and then use this information to develop policies that help improve outcomes for young children. And depending on the state that you're in, this can mean building on the strengths of existing practices, or it may mean taking innovative new steps. An additional objective for us, I apologize, I have a strange background noise here, was to be able to use what will be annual yearbook updates. As I said, we're in our second year, to monitor trends in the experiences of babies and their families and track progress in your state's policies and see how they correlate. So this year's report, one of the things that I wanted to say too as background is that this year's report presents kind of a deeper, richer portrait of babies than was presented in our first yearbook in 2019. We took a closer look at the experiences of children of different races and ethnicities, income level, and urban and rural residents, so urbanicity, looking at those subgroups, because we know that just looking at averages doesn't really give the true picture of all babies' experiences. And our feeling now, particularly amid this COVID environment, is that data clearly has always been very important, and today just more than ever. Now, amid the coronavirus pandemic, we decided to go ahead and move forward with telling the story of babies' experiences. And I just wanted to let you know that the data that I'm presenting today was released in June, and it's based on data that is pre-COVID, but I will be talking about the COVID impacts because we're already beginning to see it. And as we watched the health consequences, the immediate health consequences across the nation, the unprecedented economic impacts of COVID, we realized more than ever that it's important to tell this story. So the challenges that we already saw and that you'll see in the data that I'm presenting from the 2020 yearbook have only been demonstrated, and we see it in the media every day and in our own experiences. The information that I'm presenting has only been exacerbated by the pandemic. So it's really important that we continue to re-examine and strengthen the multiple systems that are needed to ensure that every baby is able to achieve their full potential. Next, oh, you're on the slide, the overview slide. So as you can see on this slide, and let me catch up with you here. As you can see on this overview slide, as I mentioned before, we take a holistic look at the nation's babies and then present those snapshots. We look at how infants, toddlers, and their families are faring based on what ended up being a set of nearly 60 indicators of well-being in both years. And those are aligned with 0 to 3's policy framework areas. And as you can see here, there are 3. So that's good health, strong families, and positive early learning experiences. In order to provide a quick snapshot of how states are faring, we came up with a transparent ranking system. And so some of you who are familiar with the yearbook will know that we have like a ranking of states so that you can do that type of quick comparison of how am I doing compared to other states. We wanted this to be positive and inspirational, so we adopted a theme of grow. And the GROW stands for, and we divided the states into 4 quartiles for that comparison. So the GROW stands for getting started, reaching forward, improving outcomes, and working effectively. And states can fall in any of those categories and do have capacity to move from year to year. In the next few slides, what I wanted to do was present some of this COVID, some of our pre-COVID findings in each of those 3 domains. Just some key indicators, as I mentioned, there's a total of 60 that kind of highlight, for me, the importance of the very comprehensive services available to babies and families in early Head Start, as is quite clear from the comments that you've already heard today. So I'm going to begin with just a quick snapshot of America's babies. You can stay on this slide. And as you see here, looking at the demographics, this is what we know from the yearbook about America's babies. First and foremost, the United States is home to 12 million babies. And when we look at them more closely, in those subgroups that I mentioned before that were of interest to us, more than half now of babies in the country are children of color, nearly 51%, as you can see here. And specifically, 26.2% are Hispanic, 13.7% are Black, 4.9% are Asian, and slightly less than 1% are American Indian, Alaska Native. The other 5.9% are of other or multiple races. And you can see from the center column, the gray column, white babies account for 49.3% of America's babies. So why is this important? It's important because we know that infants and toddlers of color are disproportionately at risk for potentially achieving poor outcomes in the domains of well-being. And there's a long history, of course, that leads up to that. But the negative, immediate, and long-term consequences of early inequities have been well documented. So we really didn't want to ignore that and pull that out in this current yearbook. And as many of you know from just nationally available information, there's serious racial and ethnic disparities in infant and maternal, particularly in the health area, in maternal health care and health outcomes as well. The second group that we looked at, subgroup, is by income. The youngest Americans, babies, are the most likely demographic to live in poverty. So in fact, 1 in 5 babies, close to 20%, as you can see here, live in families that are below the federal poverty level. And so that means that their families face serious challenges, usually on a daily basis, meeting their basic needs. And we know that poverty at an early age can be especially harmful, affecting later achievement and employment without proper interventions. So the last group was, as I mentioned, urbanicity, this year that we were able to look at. And as many as 1 in 11, 8.6% to be exact, of babies live in a rural or non-metropolitan area of the United States, which can mean more limited access to healthcare, education, and employment resources. And we can move to the next slide. You're there on the next slide. Okay, so what I wanted to do was dive into those 3 domains and just, again, at a high level, some of the key findings that are most relevant to our conversation today about the importance of early Head Start. Again, the pre-COVID 2020 yearbook data that we're showing here indicates several areas in which babies and their families are doing well, such as receiving routine medical visits, but they're also not doing well in several other areas. And the impacts of the COVID-19 pandemic are already evident on all of these various areas. So on receipt of routine and preventive health care, as well as exposure to increased food insecurity, which we're all very keenly aware of. I'm going to begin here with maternal health, and we have a number of indicators, just touching on a few. The first one here is late or no prenatal care, and as I've indicated here, nationally 6.2% of women receive late or no prenatal care, and this varies widely by subgroup, particularly by race. And so what I would encourage you to do is explore the state of babies data and look at how that varies. At a very high level, I can tell you for this particular indicator, for example, while 4.5% of white women fall in this category, 7.7% of Hispanic women and 9.9% Black women receive late or no prenatal care. And of course, that has implications for their own health as well as the health of their baby. I have not indicated on that slide, but it is related and important, maternal mortality. And that's important because our national maternal and infant mortality rates are particularly concerning and are higher than rates found in other industrialized countries. As far as the 2020 yearbook data, the rate of maternal mortality is 17 deaths per 100,000 live births nationally, and the disparities vary very widely across states. What I have indicated here on the slide is mother's mental health, one of our indicators. And as you can see, close to 20%, which is pretty concerning, 20% of mothers of infants and toddlers report less than optimal mental health. And that's self-report based on the National Survey of Children's Health. I want to move quickly to child health. And as you can see here, I've highlighted our indicators related to preventive care. And this is the percentage of children, babies who received the recommended series of medical visits within the last year. Nationally, that's pretty good figure. A little slightly over 90% have received that care. Again, this was pre-COVID. And dental visits a little bit lesser so, which I think, and you may or may not agree, but from your experience with Head Start, I think the dental visits, I think a lot of that has to do with this age group, and that some of that, particularly for babies, falls under the care that they're receiving during their pediatric visits. Vaccinations as a nation, we're doing less well, with just 70.4% of babies receiving the recommended vaccinations. And then a final area here in the good health domain is food insecurity, which certainly is relevant today. Nationally, 1 in 6, or as you see here, 15.9% of households with babies experience low or very low food security. And that means that they don't have consistent access to food for their families. So what I've done on each of these slides is again, with Head Start and Early Head Start being a passion for me and knowing all that it offers, as you've just heard, some of the benefits that are directly related to ameliorating some of these less than positive findings that we have. So connection of pregnant women and babies to medical homes, support of social and emotional well-being of their enrollees, providing access to services for those families who are identified as needing some additional mental health support. And of course, the focus that Head Start and Early Head Start particular has had on preventive health screenings and ensuring that there is continuous access to care, visits for treatment of illness beyond just those preventive visits. And that the data show from Early Head Start that this has resulted in improved health status for their enrollees. They also, through the programs, have complete their immunizations. And as you heard, in great detail, which was really encouraging to hear the specifics from Eva and Giovanna's discussion of all that they're doing and all they've always done to ensure that participants receive nutritious meals, both in the program, outside of the program, and nutrition education provided to families. The next domain is strong families, and I'll go through this pretty quickly just to, because I know that time is limited. And what I want to point out here is that this domain for us has a number of indicators that point to challenges, but there are some positives within it. And the one I wanted to highlight for you here, which is very germane, particularly in this time, is family resilience. More than 4 out of 5 families nationally, 85%, who have a baby report a favorable level of resilience. And so I think we should always keep that in mind. There are, however, fewer families who are who have low income who characterize themselves as resilient. That also is relatively high, 79%, but that's in comparison to families above low income who report 89%. And then next is home visiting, which is, just such a central part of early Head Start and part of the service delivery options. A number of home visiting programs have been shown through evaluations to be effective at improving one or more aspects of family well-being, and early Head Start is among those models. But as shown here, and what's troubling is that as few as 1.9% of infants and toddlers who could benefit from these services actually receive them. So there's work to be done there, and additional funding, I'm sure, that needs to be directed towards that. Last in this area is economic security, and I pulled out our Tanf participation indicator. 21.7% of families with babies that are living below the poverty level actually receive Tanf benefits. So in general, what we found across supportive policies, and I haven't indicated on this slide, is that the reach of these various supportive policies for families is not where it should be, because most families or most states are serving fewer families than need those services. And I've just outlined here the benefits, the corresponding benefits, again, for early Head Start, the type of service coordination that occurs, the family engagement component of the program. I already mentioned home-based program option, and just the connection of families to even financial capability services, education, and career planning. So the last area is positive early learning experiences, which we know, I don't have to tell to this audience, are just so central to the trajectory for children that occurs both within the families and within their care settings. And the quality of those experiences is so important. What I want to highlight here is that language and literacy skills, are fundamental to the many areas of learning and later school success. And as you see here, which one of the surprising findings for us in both years of the yearbook has been that despite the importance of early learning that takes place at home, surprisingly few American parents report engaging in daily reading or singing with their babies. And so those interactions are closely related to their children's language development. As you can see from the data, a little over a third read every day. More than half report singing, more reports singing or telling stories. And then the last part of this, which is also critical, is the importance of early identification of any potential developmental delays and intervention for those babies who are identified as needing additional services. Nationally, only 31.1% of infants and toddlers ages 9 through 35 months received a developmental screening within the past year. And of course, through all of the various services of early Head Start and the very dedicated services around early learning experiences, there is all that support, as you just heard from the previous panelists, for language and cognitive development, making that culturally appropriate as well, encouraging early home literacy, initial and continuous development in partnership with parents of plans for babies, and then coordinating services when needed. My last slide or second to the last. I'm not going to go into this, but this is just for your reference to see the, in looking at averages, the blue line is the national average for each of those three indicators I just went through, and you can see the pattern where families with babies and families below low income consistently are receiving less or served less or receive less of these activities. So now my final slide is kind of exciting to me, but I'll go through it really quickly. And that is just the overall access to early care and education opportunities and the fact that Early Head Start exists as such an important vehicle for that, for children who are most needing of that type of intervention. So as you can see here, as important as it is, only 7% of eligible infants and toddlers have access to Early Head Start services, and that's due in large part to an absence of funding. And so that's certainly an important area of focus. Let's see. And the other information that I've presented here is just to show you, illustrate to you that what we have available to you in our data shows for state by state how different that range can be. So you can see as low as 3% in Nevada to 23% of eligibles reached in the District of Columbia. But in fact, only 11 states nationally have at least 10% of eligibles participating in the program. A final point, which I'm really excited about to talk to this audience about, is that we have struggled in developing our indicators to really wanting to get at being able to compare quality of early childhood care across states. And that's something that's not easily done because states don't report it or measure it in the same way or define it in the same way. So we decided this year to use Early Head Start, which we see as the flagship model and the gold standard for early childhood development. We decided to use that as our benchmark and compare all states with using that same benchmark to meet the same standards for adult-child ratios and for class group size requirements that are within the Early Head Start program performance standards. And as you can see in these final bullet points, only 2 states of all of our states were able to meet the Head Start standards for babies. So 1 adult for every 4 infants and toddlers. And only 1 state had group size requirements that meet or exceed those standards, 8 infants or toddlers in a group. And that was at different age points for infants and toddlers. So next slide. So in closing, what I want to do is just provide our website and encourage all of you to visit it, please, to feel free to explore how babies are faring in your individual states and other states if you want to take a peek at them. And as I mentioned at the beginning, there are a number of indicators. So you can manipulate the data, you can access your own profile, download it. And we also have a number of companion materials developed there to give you information on what states and advocates are doing to advance the state of America's babies. Finally, you'll also find tools to help you navigate those state profiles and use the data in your efforts to make change for babies. So thank you very much for your time.
Thank you so much, Kim. Thank you for all that background and data. And I did go to the State of Babies here just to show our folks how interactive it is.
Yes, thank you.
And one thing that we love, right, is that ability to download the PDF. So I'm showing California's here for those from California on the call. This is easily printable, back 2-pager that you can take to a lawmaker, you can hand to your member of Congress, anything to show them some of these indicators. And you know, it's a lot of data, so maybe circle one that matters most to you, tell a story about it, and get them engaged. So thank you, Kim, for all the work. It's really striking at 12 million babies, the responsibility we all have, you know, to work together policies and funding for them, including by race, geography, and other factors that need to be understood and broken out. So really appreciate all that 0 to 3 does in this space. So let me just go back to our presentation here. And Robin Winchell is with me today. She's our Director of Public Affairs. So Robin, I don't know if we have any questions coming in from the audience. I know we're a little bit over time, but maybe we could take 1 or 2, then try to give them to our panel. Are there any questions you want to lift up for our audience today?
Yes, thank you, Kent. I think the first question is for...
So Robin, we can't quite hear you. We're having trouble hearing you.
Can you hear me now?
We can't quite hear you. Why don't I take a moment and go to the calls to action, and we can see if we can wrap up. If we can get you back on the line, we'll try that. Or if you want to try one more time, maybe we can try now. Okay, well, given the interest of time where we are a little bit over time, we always want to end with that call to action. So I want to turn it back to each of our panelists to give you a call to action today. And I think you'll find some of them surprising, and they're different and inspiring. So Ava, we'd love to hear your call to action for the group today. I think you are self-muted. If you want to go ahead and unmute. There you are. We can hear you.
There we go. Okay. Our nation is engaged in many battles right now. COVID, Black Lives Matter, and ending police brutality, and protecting voters in the upcoming election. We see the same things on the news day and night. Do not allow yourself to become complacent or lose interest. Hoping for a good outcome is like sending thoughts and prayers. Engage in the fight. Stand up for those who cannot speak for themselves, and vote.
Thank you so much for that call to action. So important in this day and age to stand up for our youngest children and our families. And we love the mask photo too. Very important for public health. So we love that, Ava. Thank you. Giovanna, what's your call to action today for folks?
I'm going to say that we need funding to support mental health, infant mental health, as our families are experiencing some traumatic scenarios within our tribes, within our state, within our communities. So thank you.
Thank you so much. And Kim, your call to action today.
Yes, thank you. I'm going to go back to some of the data, of course, as the researcher on the team and on the panel, and just say, I think I'd like to ask for additional advocacy around funding of early Head Start. I think that reach statistic of only 7%, which doesn't seem to move in the last, at least in the last 2 years, is really striking when we know the value of the program and how much it can do for children who need these services. Use the data to share your stories. I think as I really appreciate, Kent, that you showed our website, and I hope that you'll use it to arm yourself with information. And I have a 3-part ask. My last ask is just, we'd like to really report better on subgroups, and they're often groups that get left out of the discussion. And so just better data collection in the states, in communities, so that we can best tell the story of babies.
Thank you so much, and thank you to all. I know Robin is back on the line. Robin, is there a question you want to hold up before we go to our final call to action from NHS?
Yeah, we have a few quick ones. Amy McClanahan was asking Eva in the beginning if she could elaborate on the designated remote learning teams that she talked about in her presentation.
Okay, sure, I'd be happy to do that. With our first go around, we had classroom teachers also being responsible to do remote learning activities for the children whose parents didn't want them in class. And it was new to everyone. And over that span of time, we discovered some real strength in some folks to do remote learning and some others who were really stretched beyond their comfort level. So as we're planning for our fall startup, we're going to have a remote learning team, which right now looks like it could be maybe 8 teachers and 8 teacher assistants, supported by several family educators and some bus drivers, serving several hundred children in a remote learning environment. So economy of scale would allow for lesson planning and activity preparation to happen on a grander scale for a lot more children. And then the hands-on support through the teacher assistants, bus drivers, and family educators to make those deliveries out to the homes, to make a no-contact drop-off of the materials. And then the teachers themselves engaging in weekly interactive sessions with the children and families.
Thank you. And we have one more question for, I think this one for Assistant Secretary Archuleta. Someone would like to know how Early Head Start and Head Start are addressing the need for remote learning with COVID and the issue of equity and access to telehealth resources.
So through this pandemic, we really learned about the inequities when it comes to remote learning, and our state public education departments, I think our tribal communities, our federal government, and even our Head Start teachers were able to either provide computers, they were actually going out to homes and delivering kits and learning material. And I think we just had a great come together of all our providers to make sure that our children are safe, they're healthy, they have access to learning materials, and their minds and their brains are still developing in this moment. So yeah, it was either face-to-face, I'm sorry, not face-to-face, but door-to-door of dropping off activities, or seeing what parents needed to ensure they had that opportunity.
All right. Well, Robin, any other last question?
Just a couple housekeeping questions. Several people want to know if the slides will be made available after the call, and also if NHSA will provide a certificate of participation to attendees.
So I'll look into the certificate piece. Absolutely, we'll make the slides available, and we'll get that right out to you all so you have it. And I want to end with our own call to action here today. So don't go anywhere. Don't log off quite just yet, because we're going to put this, we're going to try to copy this link and put it right there in the chat box. I think everyone will be able to get it there. I think I started the call saying, you know, our work as a Head Start community and as early childhood community who supports at-risk children and families is not done. We are actively working Congress right now. Many of you are part of that, to secure an additional $1.7 billion for Head Start, also to secure at least $15 billion, if not more, for childcare. So these asks are working together in concert. And I just put the link there in the chat. If you have a minute right now, take that minute right now to click on that link and to tweet out, send a tweet to your senator. It'll take you directly there when you click on one of the COVID funding need tweets. I'll go ahead and hit that now. We need this additional resources to make this happen for Head Start and for our families. So you can click on any of these that are about how Head Start's a lifeline, the unavoidable costs that Head Start is facing. Go ahead and click on that tweet and you'll be able to do that. I want to thank everyone for being on the call today. We had over 350 folks and 800 registered, really thrilled by that turnout. This is part of a 3-part series. And it's all about building our knowledge in our community together so we can advance better programs for children and families, Head Start, early Head Start, high quality childcare, high quality pre-K, high quality home visiting, as we've heard, family engagement, culturally appropriate services, all of the things that are so important for young children and families, food, nutrition, mental health, and so many other things. Like Ava said, stay active, stay engaged. We hope you'll join us on our next couple webinars. And please do click on that link right now in the chat. Go ahead and send that tweet, and we will send a follow-up email about it too. Let's continue to push for more funding for our kids and our families. So with that, again, a big thanks to our panel. We're so honored by your expertise and your presence, and appreciate all that you do as well. So take care, everybody. Thanks for staying overtime on the webinar, and have a great rest of your day and a healthy and great rest of your week. Thanks so much.